All right, picking back up with our bacterial skin infections. Impetigo. Okay, it's a superficial infection of the skin caused by Staphylococci. Okay, where does that live? You all heard of MRSA, Staph aureus. So we need to be looking at what is naturally on our skin, and when it gets inflamed, infected, irritated, what can be the end result? All right, what's a bullae? Bullae. Okay. What would be some of our clinical manifestations of impetigo? All right. If you look at figure 56.4 is impetigo of the nostril, kind of just giving you a little bit. Okay. What would be your nursing management? So it's a superficial skin infection. So would it be more antibacterial soap daily, good hygiene, like that, all that. Okay. When would systemic antibiotics used? Right. So again, going back to when do we do it? Just normal antibacterial. So when do we start with a little bit higher hydrocortisone? When do we go to orals or IVs? All right, folliculitis, furnicles, and carbuncles. What was the difference between the three of them? And when would they occur? And what would be our education for that? All right, so the big one, now we're going to go into some of our viral. So viral, herpes, shingles. We talked a lot about shingles in class, so hopefully you remember, all right? Need to understand shingles, what it is a derivative of the chicken pox, which is varicella, all right? Why is it such a bad skin infection? What can it do? What can be the end result? So remember, it's going to go along the dermatomes, right? And it was for over 50, which we discussed in class, how it is actually hitting the younger population. So what do you think the cause of that is? What do you think causes this shingles? So if you had the chicken pox, you would have the shingles virus in you. So why are we having younger people getting shingles? All right. Remember, there's 3 phases. All right. The pre-eruptive, the acute eruptive, and post-herpetic norodular. Okay, you guys know I can't talk. So need to know those 3 phases and what is consistent of them. What's happening in each one of those phases. And then what would be the goal as the nurse in each one of those phases. Okay, looking at your nursing management. All right, and why is it important that the medications that we discuss, acyclovir, all right, and there's a couple of others, why are they given within 72 hours of onset? What's the purpose of that? Okay, ringworm. All right, table 56.6. Do need to know the different ringworms. Back up, sorry. The herpes simplex. All right, talking about the sores that people get. It's another common infection, virus by virus. All right, we have herpes simplex 1, okay, and then 2. 1 occurs where and 2 occurs where? And what was the one treatment I mentioned in class that will help with the herpes cold sores that come out during stress and illness? Okay, anytime you have a high level of stress in your body, Your body's going to counter-react, and these viruses that are normally laid dormant are going to start coming about. All right, back to our tinea, table 56.6. All right, and again, when would you just going to do a topical, and when are we going to go to the oral? All right, irritant contact dermatitis. These are your non-infectious inflammatory dermatosis. You guys know I can't speak. All right, so chart 56.4, patient education. All right, for avoiding those contact dermatitis. That's a good chart you'd be familiar with. All right, and what is also known as what? Eczema. All right, what is eczema? What are our clinical manifestations of it? What are we looking at? Okay, what would be the objective? To soothe and heal the skin, right, and protect from further damage. Again, you have that eczema, you start scratching, now we have an infection, and so on and so forth. All right, page 1842 has some key recommendations. All right, there's 1, 2, 3, 4 bullet points. Be familiar with those 4 bullet points. All right, psoriasis. What is psoriasis? We know it's a chronic inflammatory multi-system disorder. Okay. It's a non-communicable disease, involves the skin. Sometimes it can involve the oral cavity. I didn't realize I'm sitting in the, sorry for the, have that a little better. Sorry if it was dark. All right, so what is the current pathophys? It's an autoimmune, correct? The epidermis becomes infiltrated with activated T cells and cytokines. What were those? Remember those? All right. Both vascular engorgement and proliferations of the keratinocytes. What was keratin? We talked about that. So go back to what keratin does for the body, and then you're going to think about it. If it's inflamed, what's going to happen? Okay. What is our clinical manifestations? Again, it's going to be vary between different people, but just think about what our clinical manifestations. All right. One of the complications of your psoriasis, if it's autoimmune, think about it. Could we have some type of arthritis? So complications, asymmetric rheumatoid factor. All right. 42% of people with psoriasis. So you got to think about, is it because it's not being treated on a regular basis, or they just constantly have flare-ups because it is autoimmune? All right, what is going to be the medical management? If you've looked at figure 56.7, you're going to see what that dry, flaky, very irritated skin is. All right, what would be our medical management? They can remove those scales gently, right? And then what's our pharmacological therapy that they can be used? Topical, phototherapy. And now I know you hear of the commercials about other different medications for psoriasis. They can do the systemic methotrexate, which is a low dose chemo that's used for multiple autoimmune disease. Do you need to know methotrexate? Looking at that medication. All right, so what is some education we're going to teach these people about psoriasis and any of these skin conditions? You need to be thinking about that. All right, blistering diseases. All right, when you're thinking of blistering diseases, it can be from anything. It can be bacterial, fungal, or viral. All right, obviously we did talk about burns would be one of them. metabolic, immune mediated, any type of autoimmunes. So looking of the, what do you think the goal, if you have this blistering disease, what are blisters and how can it affect an individual? All right, Stevens-Johnson syndrome, we talked about that, so you need to know that. We talked about it in class, so just kind of remind to go back and read that portion of the Stevens-Johnson syndrome. Time to take a sip of coffee, getting dried up. All right, skin cancer. Okay, going on to our cancers. All right, chart 56.5, risk factors for skin cancer. You do need to know that. You just need to understand as we get older what happens to our skin. Okay, angiomas. Page 1852, need to know what those are. Keloids, we talked about keloids. What are keloids? They're overgrowth of fibrous tissues at the site of the scar. Why would that happen? What do you think would be some of the causes of that? All right, chart 56.6. What are some health promotions in preventing skin cancer? Okay, and what's a mole? All right, so chart 56.8, assessment of moles. Why are they important to review or manage or look at? Kaposi sarcoma, what is that? Right, and who are we gonna see? So we have 4 categories of that on page 1859, so please look at that. Look at those 4 categories. All right, and that is chapter 56. Hopefully this is helping, will help.